My name is Nate Lawson, and I'm the Director of Biomaterials at the UAB School of Dentistry. My expert tip today is about Class 2 composite restorations. So sometimes when you're doing a Class 2 composite on the most posterior tooth in the arch, and you're working on the distal surface of that tooth, it can be difficult to get your circumferential matrix well adapted to that tooth, particularly at that distal box. And then what can happen is when you go and restore that composite restoration, you'll have some excess material, and that distal aspect of the tooth won't be contoured well. You'll have excess material. And then you have the fun task of taking your polishing carbide and trying to stick it into that little space between the cheek and the buccal surface of that posterior molar. And you're just hoping that you don't get a laceration, and it's just not a lot of fun. So if you do get in that situation, a couple little tricks is you can put like a dry angle back there to help protect the cheek, or use something like a Softflex disc, which can get back there and polish that surface without having to throw carbide back there. But I think a little bit of effort beforehand so that you don't have to get into that situation can save yourself a lot of stress and lead to a better clinical outcome. So my little trick is something called a matrix inside a matrix technique. So in this technique, you just get a circumferential matrix like a Toffelmeier or an Automatrix or anything like that you can wrap around the tooth, and you put it on that distal tooth. And then you wedge a little sectional matrix in between the circumferential matrix and the tooth preparation. And then that sectional matrix adapts better to the distal box of your preparation. And if that doesn't work alone, if it doesn't wedge in there well enough, you can put a little bit of Teflon tape in between the two matrices, and that will just help push the sectional matrix nearer to the tooth. So that's my expert tip today on the matrix inside a matrix technique.